You might be practicing exercises that instead of helping are actually inflaming your prostate even more. This is something most men over 50 don't realize, and it's causing unnecessary suffering every single day. Many men believe that any exercise is healthy, but when you have an enlarged prostate, certain movements can make your symptoms dramatically worse. I'm about to reveal the 4 worst exercises that increase pressure on your pelvic floor and worsen your urinary symptoms. Thousands of men are unknowingly sabotaging their prostate health by doing these specific movements in the gym. The pressure these exercises create can turn mild symptoms into severe discomfort that affects your sleep and daily activities. What's worse is that your doctor probably never warned you about these particular exercises during your consultation. The inflammation these movements cause can set back your recovery by months and make simple activities like sitting uncomfortable. Before we continue, let me introduce myself. I'm Dr. Isabel Lopez, a specialist in men's health with over 15 years of experience treating prostate conditions. I've helped thousands of men understand how their exercise choices directly impact their prostate symptoms and overall quality of life. My approach focuses on practical solutions that you can implement immediately to start feeling better within weeks. I want to help you make informed decisions about your fitness routine so you can stay active without worsening your condition. I'd love to know where you're watching from today, so please comment your city below and hit that follow button for more content like this. Now, many men think that staying active means they can do any type of exercise, but that's simply not true when dealing with BPH. The wrong exercises can increase internal pressure and reduce blood flow to the very area you're trying to heal. But here's what most people don't know about the first exercise that's probably making your symptoms worse right now. The first exercise that's wreaking havoc on your prostate is intensive cycling, especially on narrow bicycle seats for extended periods. This might surprise you because cycling is often recommended as a heart-healthy exercise, but the position and pressure it creates can be devastating for men with enlarged prostates. The narrow seat puts direct pressure on your perineum, which is the area right between your testicles and anus where your prostate sits. This constant pressure reduces blood circulation to the prostate and can increase inflammation significantly over time. When you're cycling for more than 30 minutes, especially on traditional racing seats, you're essentially compressing your prostate against the bike seat continuously. This compression can trigger the same symptoms you experience when your prostate is naturally swollen from BPH. The reduced blood flow means less oxygen and nutrients reach the prostate tissue, which actually slows down the healing process. Many of my patients report that their urgency and frequency symptoms get worse on days they go for long bike rides. The pressure from cycling doesn't just affect you during the ride, it can cause lingering discomfort for hours or even days afterward. You might notice increased urgency to urinate, difficulty starting your stream, or a burning sensation when you try to empty your bladder. Some men also experience pain in the lower back or pelvic area that they don't connect to their cycling routine. This happens because the sustained pressure inflames not just the prostate but also the surrounding nerves and muscles. If you love cycling and don't want to give it up completely, there are modifications you can make to reduce the impact on your prostate. Consider switching to an anatomical seat that has a cutout in the middle to relieve pressure on your perineum. Limit your rides to shorter durations, maybe 20 to 30 minutes maximum, and take breaks to stand up on the pedals every few minutes. But there's another exercise that might be even more dangerous for your prostate health, and it's something most men do in the gym every week. Heavy weightlifting, particularly squats with a barbell and deadlifts, represent the second category of exercises that can severely worsen your prostate symptoms. These compound movements require you to hold your breath and create tremendous intra-abdominal pressure to stabilize your core during the lift. This pressure doesn't just stay in your abdomen, it gets transmitted directly down to your pelvic floor where your prostate sits. The result is that you're essentially squeezing your already enlarged prostate every time you perform these movements under heavy load. Stick with me until the end because what I'm about to share about exercise alternatives could change everything for you. When you're squatting with heavy weight or performing deadlifts, you naturally perform something called the Valsalva maneuver, which means holding your breath while bearing down. This creates a pressure wave that travels through your torso and pushes down on your bladder and prostate with significant force. For men with BPH, this repeated pressure can cause the prostate to become more inflamed and swollen than it already is. The inflammation from heavy lifting doesn't resolve quickly either. It can persist for days after your workout session. You might notice that your urinary symptoms are worse for several days following a heavy lifting session at the gym. This includes difficulty starting urination, weak stream, frequent urges especially at night, and sometimes even complete temporary retention where you can't empty your bladder fully. The pressure can also cause microtrauma to the prostate tissue, which triggers an inflammatory response that makes the enlargement worse. Instead of heavy compound lifts, you should focus on resistance training with lighter weights, resistance bands, or bodyweight exercises that don't require breath holding or extreme core bracing. You can still build and maintain muscle strength without creating the harmful pressure that aggravates your prostate symptoms. But heavy lifting isn't the only high-intensity exercise that's causing problems. There's another popular form of exercise that creates similar issues through a completely different mechanism. High-intensity running, including sprints and CrossFit-style workouts, creates repetitive jarring impacts that can irritate your prostate and surrounding tissues. Every time your foot hits the ground during intense running, a shock wave travels up through your body and affects your pelvic organs. This repetitive trauma can increase inflammation in an already sensitive prostate and make your urinary symptoms significantly worse. The faster and harder you run, the more intense these impacts become, which is why marathon runners and sprinters often report urinary issues even when they don't have diagnosed prostate problems. The bouncing motion of high-intensity running doesn't just affect your prostate during the exercise, it can trigger symptoms that last for hours afterward. Many men notice increased urinary frequency immediately after intense running sessions, along with urgency that makes it difficult to hold their urine for normal periods. The inflammation caused by the repetitive impacts can also make your stream weaker and create a sensation of incomplete bladder emptying. Some men experience actual pain in the pelvic region after particularly intense running workouts. CrossFit and other high-intensity interval training programs combine the worst elements of heavy lifting and high-impact cardio for prostate health. These workouts typically include explosive movements, jumping, heavy lifting, and rapid transitions that create both pressure and impact stress on your pelvic floor. The competitive atmosphere often pushes men to ignore their body's warning signals and push through discomfort that's actually signaling prostate irritation. This combination can lead to acute flare-ups of BPH symptoms that take weeks to resolve. The solution isn't to abandon cardio exercise completely, but to choose low-impact alternatives that provide cardiovascular benefits without the jarring effects. Walking at a brisk pace, using an elliptical machine, or swimming are excellent options that won't aggravate your prostate symptoms. These alternatives can actually improve circulation to the pelvic area, which supports healing rather than causing additional inflammation. However, there's one more exercise category that surprises most of my patients because it seems so harmless yet can be incredibly problematic for prostate health. Traditional abdominal exercises, particularly sit-ups and crunches, might seem harmless, but they are actually creating significant problems for your prostate health. These exercises force you to repeatedly increase intra-abdominal pressure while flexing your core muscles in a way that pushes down on your bladder and prostate. Each repetition creates a compression effect that can worsen the inflammation in your already enlarged prostate. The constant pressure changes during multiple sets of these exercises can trigger immediate urinary urgency that sends you running to the bathroom. When you perform sit-ups or crunches, you're not just working your abdominal muscles, you're creating a pressure cooker effect in your pelvis. The upward crunching motion combined with the breath holding that naturally occurs during these exercises creates a squeezing action on your internal organs. Your enlarged prostate gets compressed between your contracting abdominal muscles above and your pelvic floor below, which can cause immediate discomfort and worsen inflammation. Many men report feeling pressure or even pain in their lower abdomen and pelvis during or right after doing traditional AB exercises. The repetitive nature of abdominal exercises makes the problem even worse because you're creating this harmful pressure dozens of times in a single workout session. Unlike a single heavy lift that creates pressure once, sit-ups involve continuous pressure cycles that can overstimulate an already irritated prostate. This can lead to increased frequency of urination, stronger urges, and sometimes even temporary inability to fully empty your bladder after your workout. The inflammation from these exercises can persist for days, making your baseline symptoms worse than they were before you exercised. If you want to strengthen your core without aggravating your prostate, focus on exercises like planks held for shorter durations or breathing-based core exercises that don't involve the harmful pressure changes. These alternatives can actually help support your pelvic floor rather than stressing it, which may improve your symptoms over time. But now that you understand how these common exercises are working against your prostate health, let me explain why this information is so important for men in your situation. The reality is that not every exercise is friendly to your prostate, and this is something that most fitness trainers and even some healthcare providers don't fully understand. Men over 50 need specifically adapted workout routines that take into account the unique challenges of an enlarged prostate and the increased sensitivity of the pelvic floor. What works for a 20-year-old athlete can be completely counterproductive for a man dealing with BPH symptoms. The exercises I've just described can turn mild prostate symptoms into severe ones that significantly impact your quality of life and sleep patterns. Understanding which exercises to avoid is just as important as knowing which ones to include in your routine, because the wrong choices can set back your progress by weeks or even months. Many of my patients have experienced dramatic improvements in their symptoms simply by eliminating these 4 problematic exercise categories from their routines. The inflammation reduction that occurs when you stop irritating your prostate with harmful exercises can happen surprisingly quickly, sometimes within just a few weeks. This isn't about becoming sedentary, it's about becoming strategically active in ways that support your healing rather than hindering it. The science behind exercise-induced prostate inflammation is clear. Repeated pressure, impact, and strain on the pelvic floor can worsen BPH symptoms significantly. When you remove these stressors and replace them with prostate-friendly alternatives, you're giving your body the chance to heal and your symptoms the opportunity to improve naturally. The key is consistency in avoiding the harmful exercises while incorporating beneficial movement patterns that promote circulation and reduce inflammation. This approach has helped thousands of men regain control over their urinary symptoms and return to comfortable, active lifestyles. Making these exercise modifications isn't about limiting your life. It's about optimizing your approach so you can stay active without sabotaging your prostate health. The men who make these changes consistently report better sleep, fewer bathroom trips, improved urinary flow, and reduced pelvic discomfort within the first month. But there's something crucial I need to tell you about implementing these changes effectively and safely in your own routine. Join the Members Club and drop a super like if this information is helping you understand your prostate health better. Now let me recap the 4 worst exercises you should avoid if you have an enlarged prostate. Intensive cycling on narrow seats, heavy weightlifting like squats and deadlifts, high-intensity running in CrossFit, and traditional abdominal exercises like sit-ups. Each of these creates harmful pressure or impact that can inflame your prostate and worsen your urinary symptoms significantly. The good news is that recognizing these problems is the first step toward feeling better and regaining control over your symptoms. Now that you know what to avoid, you can adapt your training routine to protect your prostate while still staying physically active and healthy. This isn't about giving up exercise completely. It's about making smarter choices that work with your body's current needs rather than against them. The men who make these modifications typically see improvements in their symptoms within 2 to 4 weeks of changing their exercise patterns. Some notice better sleep quality almost immediately because they are no longer dealing with the inflammation and irritation caused by these problematic exercises. The most important thing to remember is that exercise should enhance your health, not compromise it. And this is especially true when you're dealing with an enlarged prostate. Your body is telling you something important through these symptoms, and listening to those signals while making appropriate modifications is the key to long-term success. Many men find that once they eliminate these harmful exercises and replace them with prostate-friendly alternatives, they actually enjoy their workouts more because they feel better both during and after exercising. It's not about stopping your fitness journey. It's about choosing movements that work in favor of your prostate health rather than against it. When you align your exercise choices with your body's needs, you create an environment where healing can occur naturally and symptoms can improve progressively. Take action on this information starting with your very next workout, and pay attention to how your body responds when you remove these inflammatory triggers from your routine.